My name is Bruce Nash. I'm the Chief Medical Officer for Capital District Physicians Health Plan.
My name is Harry Wilbur, and I'm a retired urologist.
I'm Jeffrey Ewell, Executive Director of Ronald McDonald House Charities of the Capital Region.
My name is Hugh Fisher, and I'm currently employed by the Urological Institute of Northeastern New York, which is a urology group affiliated with community care physicians.
I first met Bill Cromie in 1979 when he came to Albany.
I've probably known Bill for 25 plus years.
I actually met Bill through a letter before I actually met him physically.
I met Dr. Cromie about 6 years ago when I became Executive Director of the organization.
The thing that makes Bill unique in his field is his level of energy. He just injects a level of energy that invigorates everyone. He is so diverse in his knowledge, and he brings so many new ideas and concepts into things and encourages people to do the same.
Yeah, one of the many things that impressed me about Bill is that his involvement even in the community outside of just being the CEO of CDPHP. The number of things he was directly involved with, providing leadership to, support, spanned many aspects of the community. In fact, I think the last time we had lunch together, he was coming from volunteering at the soup kitchen. So he really almost had no bounds in regard to who he was willing to support and how many hours a day he was willing to put into providing that support.
The strong point for Bill was, I think, his approachability, and again, his affability. And of course, as a surgeon, his ability, meaning that he knew his field extremely well. He was very excited about it.
We all know, he was instrumental in the founding of the Ronald McDonald House, the various other charities. He had the Wounded Warriors Project, and was very active with that, and still put in enormous hours just in the normal role as it was. So again, the level of energy, passion, compassion is really something that is a role model for all of us.
I really feel very privileged because I go back to the time when things were really fun, and we worked very hard. And I think Bill's contributions in the operating room, I remember for some difficult reconstructive cases, him coming over to the VA and helping out, and it was that type of contribution that was just indispensable. But beyond that, when the work was done, we played hard. And oars, going back to Tom Whalen and Neil Kay and Bill Cromie, the Albany Regatta, that was a very special time in Albany's history, and I think we all enjoyed it. And I personally feel it's really too bad that we don't have that anymore. Then there was the formation of Adirondack Whitewaters, and we all went up to the Adirondacks for the snow melt, and Bill took us down the river, whitewater rafting. It was good. Yeah, we warmed it up. We warmed it up with a little, and the barbecues up at his camp on Sacandaga. Just living life to the fullest and enjoying it and appreciating everything we had, and couldn't have done it with anybody to that extent other than Bill Cromie.
My Dr. Cromie moment, if you will, might be hard for me to get through, but it was earlier this year when we attended a funeral for a young lady who passed away. She was one of Dr. Cromie's first patients when he moved to Albany. She lived a really hard life. She had medical problems all throughout her life, and Dr. Cromie was really her first surgeon. And I happened to go to the wake around the same time that Dr. Cromie was there. And we were a few people apart in line, and I smartly skidded back to share a couple of moments with him. But after we were through greeting the family and paying our respects to Gene, they had out a scrapbook of items and clippings from Gene's history. And Dr. Cromie sat there while I was speaking to other people in the room, and he read that book about Gene. He had to be sitting there about half an hour, all alone, paying his respects in his own special way to that dear girl. And that really encapsulated him to me, because so many people at wakes, they come and they go and they look to get out. And he was there in that moment with Gene, just like I'm sure he was every time he cared for her, every time he laid his hands on her, every surgery he did for her.
My name is John Ciccarelli, and I met Dr. Cromie in 1992. Before we met Dr. Cromie, the other physician that was treating Luke was not certain if there was anything that could be done. We met Dr. Cromie, my wife Elaine and I, and he examined Luke and assured us that this was a common problem. He was only about a month old when we first went to the office and Dr. Cromie examined Luke. He said, "We'll see you in a year and don't worry," which really relieved us tremendously. 1 year later he said, "Okay, he's old enough, let's get him into surgery." And Luke went back for his follow-up checkup a week or two later, and he's been fine ever since. Dr. Cromie, it was really a blessing that we had the opportunity to meet you. I know that the foundation that is named on your behalf will help many other families with similar problems and maybe more severe problems. And so my family wants to thank you for that.
Hi, my name is Luke Ciccarelli. I met Dr. Bill Cromie when I was a mere month old. I just want to say thank you because for all that you've done for me, I've got to experience everything. And for what you did to me, I appreciate that more now because I've experienced a fulfilled life.
Bill, it's been an honor and a distinct pleasure to be able to make these comments about our relationship and the time that we worked together. I think this fund that we're establishing in the Capital Region Medical Research Foundation will go a long way toward funding much-needed pediatric urology research.
Dr. Cromie, on behalf of the Ronald McDonald House, our board of directors, our volunteers, and most of all the families that you've helped serve over the years and that we continue to serve in your name and your honor, we want to congratulate you on this wonderful event, being recognized with the Dr. Cromie Pediatric Urology Research Fund. It's an amazing accomplishment and testament to what you mean to our community and all the kids and families that are going to need those services that this research will so vitally fund.
Bill, I have to tell you how honored I am to participate in this tribute to you, but more importantly, to participate in this effort for the funding to benefit children for hopefully generations to come.
Bill, I have to tell you that you are definitely deserving of this recognition. And the fact that there's a fund being established to support the children that you've cared for so many years is really something, again, you should be very proud of, as we are. I am just honored to be here, to be able to offer you my congratulations and wish you the best and for your continued work, because I know that you have many, many other lives to touch.
When I think of Dr. Cromie, if I had to summarize it in one word, it would be healer.
Everything to one word, it's energy.
I think the one word that I would use to describe Bill is compassion.
Well, I'd say 3 words, one of a kind. Or it's 4 words.